This dashboard was built by Essentia Health's Enterprise Analytics Department and is intended to monitor the state of COVID-19 in the upper Midwest, specifically in Wisconsin, Minnesota, and North Dakota. We pull case and testing data from various public sources and calculate a number of relevant metrics at the county and state levels. The bar at the top indicates the most recent data, the date of the most recent data, as well as the total cumulative cases in each state as of that date. The map will show the most recent value for a particular metric at the county level. So the list of the metrics available to look at is on the left side drop-down menu, and a description of the particular metric will show up underneath the color legend. Hovering over a particular county will show the metric value, the population. The top graph will show the total case count over time, and the bottom graph will show the selected metric over time. The graph on the top right will show the selected metric at the state level over time, with the most recent value for each state called out on the right-hand side. Selecting a state from this upper left-hand side menu will update the map to show just that state, and it will also highlight the line for that state on the upper right. The graph on the bottom right is a simple projection of case counts in the next 2 weeks. A range of projection scenarios are calculated using observed doubling rates from the previous week. So the doubling rate is the number of days to double the number of cases. A fast growth, medium growth, and slow growth scenario are calculated using the observed doubling rates from the past week and projected out 2 weeks forward. So choosing a state from this menu on the top left will also update the projections for just that particular state. In terms of the metrics available, the 14-day number of new cases for every 10,000 people has been a simple way to estimate active cases in an area. This has been very helpful for communities to understand the current prevalence of COVID-19 in their region and how it might be changing. The percent of tests that have been positive in the past 7 days is also a very helpful metric. However, there are a couple caveats with this. The most obvious being that Wisconsin reports their data at the individual level. So the percent positive in Wisconsin is calculating the percent of individuals who have tested positive for the first time, whereas in North Dakota and Minnesota, this is calculated at the individual test level, regardless of how many times an individual has been tested. This is why the numbers look dramatically different between Wisconsin and the other 2 states. However, it's still helpful to determine trends within a particular county when you hover over that county, and you can see that bottom graph shows how the percent positive is changing for that particular area. This data is updated daily during the business week, Monday through Friday, and made available to the public. Please don't hesitate to reach out to Essentia Health if there are any questions or concerns.